most of the people, heart attack can lead on to cardiac arrest. Not every heart attack can lead into cardiac arrest, where the electrical activity becomes irregular to the point that you don't have a good rhythmic contraction so that there is a pulse. So sudden cardiac death is an electrical event, whereas the heart attack is usually a structural event where there's lack of blood supply to the part of the muscle, and the muscle doesn't pump because it doesn't have the fuel or the blood going to its own muscle.
Wonderful. So now we are going to come to our demo session, doctor. So I wanted to ask you, like you were putting your palm and you were telling us how to do the pump. So if you can tell us, is there a particular position we have to lock our palms, or how do we do that? And how do we know how much pressure to put in?
Got it. All right, let me answer your question and then we'll reiterate because it's an important aspect of it. So the heel of the hand right around here, and you lock it with the other fingers, right? Okay. And then you find out where you're going to place the hand. So breastbone or the sternum and the bottom half of it. So it goes from here to here. Right? So this is the collarbone. This is the trachea or the windpipe. This is the collarbone. So just around where these collarbones start to the point where this ends, the hard structure, and this is the stomach or the abdomen, right? So this is the sternum or the breastbone. And the bottom half of it is where you put in the midline. That's where you put it. And then I'll try to, yeah. So now you put your hand and you lock it, and then you're going to stay by the side of the patient. Make sure that your elbows are straight, the shoulder is straight, and you're going to do the chest compressions. As you are doing it, you got to make sure that there is enough recoil. You're pushing in and then making sure you are relaxing. If not, the heart is not filling up with the new set of blood. So while I'm pressing it, you're pumping that blood from the heart to the rest of the body. And then when you're relaxing it, it's filling up with the fresh set of blood that is coming from the lungs, which is fresh blood. So that's what the plan is. So this has to be done at a rate of 100. So that needs the practice. So I'm going to show we use this metronome. So that's the speed. Can you hear that? That's a metronome. So you get the point, right?
Yes.
So that's the chest compression. So, in adults, you want to push at least 2 inches inward, right? So that way you are compressing the, normally heart pumping it. So that's why it's able to push that about 70 ml of blood with each contraction. It's going to pump that blood. That 70 ml is going with each pulse to the rest of the body. So if it beats for 70 times per minute, so you're getting about 5 liters of blood that is being pumped by heart each minute of our life. So it's pumping from our birth to death. Similarly, brain is acting from birth to death. They are, these are the organs of, the circle of life. So these need to be maintained. Similarly, for the breath, it has to continue. If you don't breathe, obviously the circle of life is going to be stopped. So that's why it is very, very important you maintain these 3 functions of these 3 major organs.
Okay, wonderful. So does it matter which hand I put first and then I lock with which hand, or?
Doesn't matter. The dominant hand on the patient is better. Yeah.
Okay.
So the point is to put that, compress the heart is just below or, behind this sternal bone, right? So what you're trying to do is give that pressure to the heart. If this is the heart, you're pumping it, right? So instead of it pumping you're doing that external force to pump the blood out of the heart.
Got it. So we're reminding the heart, your function is to pump yourself.
Right, exactly. So by restarting it,
wonderful.
you reestablish
Right.
the blood flow to the rest of the body and also the heart too.
Very well. So what is the recovery position? Like, is there a particular position that we have to do this compression?
No, you always do it when the patient is flat. But when the patient recovers, after the patient recovered, what is considered recovery? We talked about it earlier briefly. That's called ROSC, a return of spontaneous circulation. So that means they have their own pulse. That means their heart is beating and they have their breathing. They are breathing on their own. So when you have that return of circulation, that's when the patient starts moving or starts to wake up because they have the pulse of their own. And that's when you can put the patients on the left side. If somebody is vomiting, that's one of the good things that you need to turn them to one side, preferably to the left side.
Is there a reason why to the left side?
Stomach is on the left side. If the stomach is full of the contents, so that's one of the reasons. And, especially in pregnant women, you want to make sure a full, third trimester pregnant woman who has, abdomen, the weight of the baby or the full uterus is going to push on the blood supply coming back towards the heart. So if I can demonstrate, so the blood supply from the legs is coming back from one of the blood vessels back towards the heart. So because of the weight of the pregnant uterus, so that is going to push on it. So what we do is like in pregnant women, so if we have enough of rescuers, we push the belly to the left so that it is not compressing on that blood flow coming back to the heart. It's preferred to do it, obviously, medical professional or some good BLS training to be able to do that. So you don't want to harm unnecessarily.
Right.
So
that
that's why,
actually makes sense.
yeah. So that's why I reiterate this thing, learning or reading or looking at these, videos are mainly to motivate people to go through the training. Because half knowledge is dangerous, and untrained skills are also similarly dangerous. Without your, intention, you could easily harm somebody. Without helping them, you could even harm them too. So that's why I come back to that same thing again and again, that it's very, very important. And it's a very great feeling. And, if anybody get that certification, they really feel very empowered in a way. I remember, I probably did more than 2,000 of these cardiac arrest situations in my 25 years of my professional life. And there are situations where they revived, and there are a lot of patients that they come back and they are alive because of our team effort that we were able to bring them back. So it is very, very rewarding. This is one of the most rewarding things in anybody's professional life as a physician or as a medical professional, is that your ability to revive somebody and bring the life back is priceless.
That is amazing. Yes, and it's definitely priceless because you gave them a second life, and so thank you for doing what you do, and thank you for giving us hope and faith. So I'm going to move to my next question. What if somebody has asthma? Like now, if there's a stranger, we don't know if they have asthma or not, but if somebody has asthma and they collapse, what should we do? Will CPR help in this situation?
Yes, I think there are many reasons why a patient with asthma will have a collapse. So again, it goes back to, irrespective of the condition that made them collapse, the principles of what you do are very, very simple and straightforward. So again, make sure it's safe, number one. Number two, make sure that you assess them, in the form of, are you okay? Number three, ask for some help. Number four, check for the pulse and breathing. And number 5, start the chest compressions if there is no pulse. Whereas if they are able to breathe, I mean, they are able to say they collapse, but they woke up and they are struggling to breathe for asthma, immediately I would ask, do you have any of the inhalers with you? Because what is needed at that time is to relieve the obstruction to their breathing tubes. That's why they are not able to breathe. So giving those inhalers will help them. So as long as they have the pulse, they're responsive, that is different. If they don't have the pulse and they're not responsive, you need to immediately, it doesn't matter what was the underlying process that led them, whether it is heart attack, sudden cardiac death, stroke, asthma attack, or a blood clot going into the lung, or low oxygen state, or any of those things. The ultimate thing that the collapse of this, circle of life, this triangle, is what leads to, the need for the cardiopulmonary resuscitation.
So you said to check for the circle of life and keep the thrust on. You said for every 30 pumps, 2 respiration. How do I know if I'm doing all this? How will I know that this is actually working?
So when do you stop that? In my presentation, I have it. At what point you stop it is, one is obviously you have return of spontaneous circulation, or we call it as ROSC, ROSC. That means patient started to move. That means your efforts to restart this whole process of electrical, mechanical, and of the heart and the breathing, and thereby establishing the consciousness, and they started to move. So the whole thing is restarted again. Okay, so you reset the system in a way. So it's back again. Sometimes they can go back again, but at least at that time they have recovered, and you need to make sure that the advanced cardiac life support providers are available, and they will take over, and then they get them to the right place. So until that time, you need to make sure that you provide that same cycles, 30:2. If you have another member who could provide the ventilation while you are doing the chest compressions, and you switch every 2 minutes or so, because it is tiring. You don't want to fatigue yourself, and the fatigue that is set on doing this chest compressions will lead on to less effective chest compressions. So the key aspect of this whole resuscitation, the increased survival for the patient, depends on effective chest compressions and early defibrillation if it is needed. Early defibrillation, we talked about the AEDs earlier, is that the defibrillator, or where you give the shock to the patient through electrodes placed on the bare chest on the side, or one in the back and one in the front, depending on the patient. And as you pass that electricity in a safe way through the heart, you are, basically stopping the irregular rhythm, unstable, irregular rhythm of the heart, and making it restart, jumpstart all over again in a stable rhythm. A stable rhythm will have good pulse. A irregular, chaotic heart beating is ineffective breathing. There is no effective pumping out of the blood out of the heart. Thereby, there is no pulse. Because there is no pulse, the system is failing. By doing that shock and resetting them into a very pulsed rhythm, where you can feel that mechanical contraction in the pulse, is what is the main goal of that defibrillation. So very quickly, while we are at the topic, I'll say, if you have that AED available and you connect that AED, and then you more newer AEDs, they analyze on their own as soon as they are connected, right? Some of them, they need the power on button to analyze. When you are analyzing it, you don't want to press the patient, because that's not going to be the correct analysis. So you give a few seconds so that the machine will analyze, and it will say very simply whether it is shockable rhythm or non-shockable rhythm. If it is a shockable rhythm, you charge and press the button and make sure that nobody is touching the patient so that the shock or that electricity is not coming to them. And then immediately after that shock is given, you do the chest compressions back again. So the take-home message here is effective chest compressions and early defibrillation. If we do that, we establish the rhythm, a stable rhythm or that generates a pulse, meaningful pulse, and you're establishing the circulation.
Circulation. Okay. Perfect. So we touched in the beginning, there are different ways or different techniques for adults versus kids. So I wanted to know what are some of the causes for CPR that we might have to use on infants and on children?
So in children and infants, so usually the causes for the cardiac arrest, that they need the chest compressions or cardiopulmonary resuscitation are mainly driven by respiratory failure and shock. So there is more of that respiratory related problems in children as opposed to adults. So whenever we are doing the chest compressions for the children, depending on the age, if it is an infant, you use just 2 thumbs. If you use the whole hand and put too much pressure on a young child, infant, that's not going to be good. So what your goal is not so much, you asked earlier how much pressure to give. The pressure enough so that you are roughly pushing that 2 inches, or in children, 1/3 of their chest wall size, rough estimate. So the point is, it's very hard to, that's why the training is very important. In that training, a practical session, they are going to train them the position of the hands, how they are going to make sure that the shoulders, elbows, and wrists are in line. And that's how you do it in adults. In children up to age of 8, above the age of 8, you can still do the same. And, in infants, because they are small, you use 2 fingers and use those 2 fingers to press on the heart. So the other approach is like you can hold the baby like this and use your 2 thumbs like this, and then do the chest compressions like this. If this is an infant, I'm holding, and that's another way of, obviously you're not holding like this, you're, on a flat surface always. And then you're using the thumbs to press on it. So in order to show it, I was holding like this, but you are always putting it on a flat surface so that there is enough of, it's not, there's support on the back, in other words.
Wonderful. Thank you for that. And we can't emphasize enough that a good training can actually help one of your close one, or you can actually save somebody's life. So thank you for that. So with that, I'm going to be wrapping today's session. eGlobalDoctor is one complete healthcare platform for all medical related issues and questions. And maze ki baat hai that these services are available to you at your fingertips without breaking your bank, and you don't have to drive. You can be at the comfort of your living room and have these services available to you. You can find and connect to eGlobal on LinkedIn, Facebook, Instagram, Pinterest, YouTube, Twitter, all the old-fashioned way, eGlobalDoctors.com. If you are a doctor and if you are looking to contribute in telehealth visit and build your network, eGlobalDoctors is formed by a group of physicians from UK, India, and USA, 290 plus doctors, board certified, 60 services, 8 plus different countries. You can provide consultation counseling services to patients anywhere in the world, opportunity to provide charitable services and patients, be part of fast-growing innovative telehealth company with a chance to invest at discounted rate. Liability insurance will be provided. Visit or register eGlobalDoctors.com for more information. So before I let you go, Dr. Prasad, any word of wisdom you want to share with our listeners and our viewers?
Certainly. I'm just going to briefly go over the things that we talked about. One is that, we want to make sure it is safe, effective, and the end goal is to return of circulation. So the mnemonic is basically ACT: assess, call, and treat, act, right? So when we see a patient who is not breathing, the natural response, especially from a person who is not in the medical field is that they panic. Instead of panicking, they need to remember these three things: assess, call, and treat. Assess is what we talked about, checking the, making sure that they're responsive, the pulse and the breathing. Call is like they reach out for, either they shout or they call somebody, the 911 on their phone, and then treat. So the defibrillation and the chest compressions are the key, along with giving the breath. So, and then return of circulation, spontaneous circulation is the end goal. So I just want to make sure, and then I encourage each and everybody, whoever is listening, make sure that you get your BLS certification, so that you never know when the time comes, whether it is a stroke, whether it is a heart attack, whether it is a cardiac arrest, or whether there's a choking victim, or a baby who's drowning, or any of those situations, and you will be ready. At least you will be giving your best effort, so that you will not regret that moment that you did your effort to save the life.
That's wonderful. Well, there you have it. We cannot stress enough on getting a good BLS certification. So thank you for that. With that, this is Kunjan signing off. Sayonara. Stay safe till we meet again. Keep smiling always. Namaskar, doctor. Thank you.
Namaste. Namaste.